Hi, I'm Amy Hopkins, president of the Parrot Club, and I want to welcome everybody to the May 2026 meeting. Dr. Kristin Sinclair will be talking to us about cardiovascular disease in parrots. Dr. Sinclair is a New Hampshire native, and she received her veterinary degree from the University of Tennessee in 2005. She then completed a small animal rotating internship at Garden State Veterinary Specialists in 2006 and an avian and exotic internship at the Broward Avian and Exotic Animal Hospital in 2007. She completed residency in companion animal and exotic pet medicine and surgery at the University of California, Davis in 2011 and became a board certified specialist in avian medicine in 2012. In 2016, she received her Exotic Companion Mammal certification. She moved back to New England in 2011 and joined Kensington Bird Animal Hospital in 2013. Her interests include soft tissue surgery and small mammal medicine, particularly small rodents. She's owned by 2 rambunctious cat beasts, 2 leopard geckos, and a merry mischief of rats and mice. With that, I will turn it over to Dr. Sinclair.
Great, thank you, Amy. Okay, and yeah, screen share. All right. All right, so tonight we'll be talking about avian cardiology and cardiovascular disease. So we are increasingly recognizing cardiovascular disease as a significant problem in our companion birds. And this can basically be divided into the acquired diseases, the diseases that come with age and insult and injury, versus the congenital diseases, the things you're born with. There are definitely some diagnostic challenges in getting an answer for your bird, just based on their anatomy and their tiny size versus the equipment available to us and the technology available to us. We definitely have our challenges in diagnosis, but we still can learn quite a bit about your parrot. Likewise, because this is kind of an emerging issue that we're learning more and more about, we do also have limited data on prognosis and treatment. A lot of it is restricted to single bird case studies where, hey, we diagnosed this in a parrot, this is how we treated it, and this was the outcome. We don't yet have the big studies as they do in dogs where, say, we had 100 dogs with this particular type of heart disease. We gave this group treatment X, we gave this group treatment Y, and this is why group X did better. A lot of it is just based on, this is what I would do for a dog, so this is how I'll adapt it for a bird. But every day we're learning more. So roughly we can divide our cardiovascular diseases into kind of the heart diseases and then the vascular type diseases.
Kristin,
yes?
There's a bar on the bottom of your screen. Could you hit the little hide button, please?
Oh, yep. Boop.
Perfect. Thank you.
No problem. All right. So the most common types of heart-specific disease we see in birds include valve dysfunction, where your valves are not closing correctly, and cardiomyopathy. Myopathy referring to heart muscle, so the heart muscle itself is not functioning correctly. With vascular disease, we have atherosclerosis, which is the buildup of plaques within the arteries, and hypertension or high blood pressure. So we'll talk about these. We'll go into the diagnosis of these diseases, treatment options, and prognosis, what to expect out of it. So the basics of the bird heart, they have a lot of similarities with us in that they also have a 4-chambered heart, just like mammals do. This includes 2 atria. These are the collecting chambers of the heart. So they receive blood that is returning back to the heart from various parts of the body. And then there are 2 ventricles, left and right. And these are the pumping chambers that send blood out to the lungs or the body, depending on which side it is. The right side of the heart here, this is what handles the blood returning from your body and going to the lungs for oxygenation. This is a less muscular part of the heart. Since the blood doesn't have very far to go to get from the heart to the lung, you don't need as strong a muscle, nor do you need as big a chamber. The left side, left atrium and left ventricle, they're in charge of collecting blood that's returning from the lungs, nice oxygen-rich blood, and then they pump it out to the entire body. Because you've got to go anywhere from the tip of the nose of a ostrich all the way down to the legs of a stork, this chamber has to be very muscular, very big and strong so that it can get blood to all those distant body parts. Now this here is just a schematic. Here's a comparison of hearts in different species groups. Interestingly, even though evolutionarily birds and reptiles do have a lot of common ground, bird hearts tend to be set up very much like mammalian hearts instead of reptile hearts. Now, this reptile heart is kind of a generic, if you will, reptile heart. The one group that does not fit this bill is the crocodilians. Your alligators and crocodiles have mammalian and bird-style hearts with 4 chambers, whereas the rest of their cousins have just this 3-chambered deal. Fish, super weird and interesting. They're basically this like 2-chamber tube thing that squeezes. So, kind of a schematic of how exactly the blood flow works. So, down here on the bottom, this systemic circuit here represents the body, so your feet, your head, etc. Blood coming back from the body tends to be very low in oxygen. It returns to the right side of the heart here, the right atrium. It flows through a valve down into the left ventricle and then gets pumped out to the lungs where it picks up oxygen, then flows back to the heart. And here's your left atrium, which is your collecting chamber, down into that powerful left ventricle, which sends it shooting out back to the body, and the cycle begins again. Now, this is a little bit closer of a representation of what a bird heart actually looks like. It still exaggerates the size of the left side or the right side of the heart a little bit, but you can see roughly how it looks in the actual bird. And again, you can see how blood comes in, down to the ventricle, out to the lungs, and then back through these veins here, down into the left ventricle and out to the body. So, just to throw out some terminology that you may hear either tonight or potentially from your veterinarian someday for your bird. The descending aorta. The aorta is the artery that leaves your heart, and all blood vessels to the rest of your body branch off of the aorta. The descending aorta is the part of the aorta that goes to basically the main part of your body. It covers everything from your shoulders on back. The brachiocephalic trunk is a branch off of the other side of the aorta, and this was what gets blood up to your wings, your head, and your neck. The pulmonary arteries carry blood from your right ventricle to the lungs. Moving on to your veins, the vena cava is the big vein that brings blood back to your heart for pumping to the lungs. It has what we call a cranial and caudal portion to it. Cranial referring to coming from the front part of your body, and caudal referring to blood coming from the back half of your body. But they meet at the right atrium, and oh wow, I said right ventricle there. Whoops, typo. But it carries blood back to the right atrium so that you can pump it out to the lungs for oxygenation. The pulmonary veins, they return blood from your lungs to the left atrium. Just a little fun fact, if you're ever on Jeopardy someday, the pulmonary veins are the only set of veins in your body that actually carry oxygen-rich blood. We tend to associate veins with having oxygen-poor blood, but realistically, they're just named for, are we bringing blood to the heart or from the heart? So with heart failure, what happens when your heart starts to fail is that it just can't pump blood effectively. And the result is that your blood is not going to move through your heart and therefore through your body as it should. So you can imagine it like imagine a lazy river at a water park. Normally the water just keeps circulating around in this big loop. If you were to stack up a bunch of wooden planks in the middle of that, the flow of that water is going to be blocked. And so you're going to get water backing up behind all those wooden planks and not much getting past them to supply the rest of the lazy river. And you can think of the heart kind of like that plank in this instance. If the heart can't get the blood moving, the blood's going to back up and things are going to start to enlarge and to fail. So first off, it'll start backing up in those collecting chambers, and you'll see those atria, the collecting chambers, start to enlarge because they're getting filled with more blood than they can handle. Eventually, this starts to affect all the veins that are returning to the heart, whether it be the pulmonary veins or the vena cava. Once you get blood backing up in blood vessels like that, this is when fluid leakage happens. see, I should have a picture on the next slide to help explain this. The signs that you will see really depend on what side of the heart is failing, basically what is upstream of the part that's not working. So with the left heart, blood starts backing up in your left atrium first, and then your pulmonary arteries. Where those pulmonary arteries, or pulmonary, I'm sorry, that's the pulmonary veins. Man, I made a lot of typos. Then in the pulmonary veins, those pulmonary veins are coming back from your lungs. So if that side's not working, you get fluid leaking into your lung tissue. The right side, first the right atrium starts to enlarge. Then the vena cava and all those veins, everything upstream starts to become overloaded with blood that can't move. So you get fluid leaking into your body cavities and various organs instead. Specifically, the liver is one we will commonly see start to enlarge because it's getting filled with fluid that's leaking from the vessels. So here we have a picture. If any of you are gardeners like me, this is a soaker hose. And it's a common tool used to water your garden without having to spray a hose or anything. Now, the way this works is that there's a hose, it attaches to the end here. This side is capped over here. So as this fills with water, eventually it reaches this obstruction here, and that forces the water to leak out through these little pores all throughout the hose. This is basically what happens when you're in heart failure. Because your blood can't move effectively, fluids just starts leaking out between the cells that make up your blood vessels. And so you get fluid pooling in your lungs, outside your lungs, around your liver, in your liver, you name it. So with heart disease and cardiovascular disease in general, what will you see at home or what will we see at the vet? Now, with either of the heart diseases, whether it be a muscle problem or a valve problem, in birds, they tend to look very much the same. I can't look at any given bird and say, oh yeah, that's totally a failing valve. We've got to dig into it. The signs are going to look the same. So at home, you might notice that your bird tires more easily than usual when they're flying or playing with their toys. Some folks report that their bird is wobbly or kind of weak on the perch. They're kind of weaving back and forth. They might tip over and fall off the perch, or they may lose their balance or their grip very frequently. You may notice an increased breathing rate or effort. And this may look like movements of their keel bone that are just more pronounced than usual, exaggerated, where normally you might just barely be able to pick up on the keel movement. Maybe you're seeing it move a little bit more vigorously than you're used to. A tail bob is also a telltale sign of a bird that's having difficulty breathing. And what this is as your bird is sitting on a perch, you may notice its tail rhythmically ticking, kind of up and down and up, and it matches their respiratory rate. This is happening because the bird is putting so much effort into breathing, it's affecting their position on the perch. The tail is bobbing to help them stay upright. You may notice an enlarged belly, what we call coelomic distension. This often happens when fluid is building up in the belly during heart failure, or it can indicate the liver is enlarging due to heart failure. Many people will mistake this for egg binding. Many folks, they will look at their bird, they'll see a belly that's enlarged, and they'll think, oh, egg, my bird is egg bound. Well, I'd say maybe 50% of the time when we see them, that's true. But the rest of the time, not so much. And of course, sudden death. As we all know, our birds are really good at hiding things from us. They will truck along with terrible failing organs, and we will not know about it until they literally drop from it. So with vascular disease, these signs sometimes may mimic what you'll see with heart disease, where the bird tires more easily than they normally would. They may be wobbly and falling off the perch. You may notice, especially with, say, atherosclerosis, that the bird is just not using its feet very well. It's kind of dragging its toes a little bit, can't grab perches or toys quite as strongly or coordinatedly as they normally would. I have seen a couple where feather loss was the sign of the problem, where suddenly they're dropping wing feathers, flight feathers, and the owners are not seeing the bird actually pick these out. It's a weird one, but I have seen cardiovascular disease lead to feather loss. With hypertension, much like with people, there's not always easy signs that you can see early in the disease process. This is why our doctors check blood pressure on us every single time they see it. They're trying to catch it while it's relatively mild. In the vet's office, you may notice that, hey, my bird is just randomly had a nosebleed during its physical exam, or it's bleeding from its eye. Now, so many people look at this and think, oh yeah, my bird is stressed. Oh God, he's bleeding because of it. Well, this is not a normal response to stress. Yes, the bird's blood pressure will increase in the vet's office, just like any person or pet going to the vet's office. Yes, your blood pressure will increase. It should not increase to the point of spontaneous bleeding. That is a problem. That tells me the blood pressure is way too high. And blindness sometimes is the sign that we will pick up. Regardless of your species, one of the potential areas that will be impacted by high blood pressure is your retina. Your retina is very delicate tissue. If those blood vessels are suddenly receiving a lot more pounding pressure than they're used to, this can damage the retina even to the point of detaching the retina. And well, your pet won't see blindness, but blindness can develop as a result. And it's not always a correctable problem. So in terms of the examination, and this is going to be similar to what you'll see at home, I might notice an increased breathing rate or effort. I may see the bird having difficulty using its feet. For example, they try to grab at me while I'm looking at them, and it's like they're using little club feet. They're just not grabbing, they're not moving their toes, or they grab me, but they've barely got a grip on my finger. I may hear a heart murmur with my stethoscope. A lack of a heart murmur does not necessarily mean a healthy heart. It just means that we're not getting turbulent blood flow that my stethoscope can pick up. I may notice an arrhythmia, and this refers to an irregular heartbeat. So we may see skips or pauses in the heartbeats. We may see that the bird is speeding and slowing with no discernible reason or good explanation for it. I will also be listening for the respiratory sounds. Under the stethoscope, I may hear crackling, kind of like the crinkling of cellophane almost, as the bird is breathing in if, say, there's fluid building up. Or I may notice that, this bird is just oddly quiet under the stethoscope, where either I'm having difficulty hearing the heartbeat or I'm not hearing any air movement in this bird, despite the bird putting in a lot of effort into breathing. And of course, we may notice the coelomic distension, which often is fluid or an enlarged liver. Over here, we've got a picture of a cockatoo, and I think we can all appreciate how big and swollen this belly is. And this is a cockatoo with a lot of fluid buildup in its belly. The body wall is quite stretchy here, so it can get pretty enlarged. But you can see, as you look at it, you can see how people would mistake that for like egg binding or something, because yeah, it looks like that bird could possibly have a giant egg in there too. So in terms of the testing that we do, there are some things that are helpful and some things not so much. Radiographs or x-rays tend to be a good place to start, and it's something that a lot of vets will have handy. It's not the end all be all, and we'll go into that in a moment. Coelomic ultrasound, and this is where we take an ultrasound probe and look at the bird's belly. This would be, say, how we distinguish fluid from an enlarged organ when we see that big enlarged coelom. Echocardiogram is the medical term for the heart-specific ultrasound, and this is where we take that ultrasound probe, aim it up underneath the keel to see the heart function. Electrocardiogram is where we measure the electrical activity of the heart. Produces that little waveform that you'll see on medical flyers and such. You'll see an example in a moment. We can do indirect blood pressure measurement, which is what we get done when we go to the doctor and have our blood pressure checked. Now, things like blood work are usually not typically helpful with the diagnosis of heart failure or cardiovascular disease. There's generally nothing here that's specific to the heart. So a complete blood cell count, which looks at your red and white blood cells, your platelets, usually not very helpful for diagnosing any heart disease, but often we will still do it just to make sure there's no other issues going on with the bird. Likewise, with biochemistry profile, this looks at your organ function, electrolytes, blood proteins, blood glucose. This is also typically very normal with the bird with heart disease, but specifically this one might be a good one to pursue because some of the treatments we will use to treat on that bird can affect things like your electrolytes, and it's good to see where you're starting out and track where those electrolytes go in the future. So with x-rays, we're looking at the size and shape of the heart. You want to see, if there are any obvious enlarged chambers or if the entire heart is enlarged or abnormally shaped. We can see the larger blood vessels, the ones that are leaving and coming back to the heart. We are able to take a look at the lungs on x-rays. This will tell us if there's fluid starting to build up in that lung tissue. Likewise, the size and shape of the liver can guide us. If it is starting to enlarge, that can be a sign that the heart is failing. We can also see the fluid in body cavities. However, it can obscure the view of other structures. Fluid in organs have the same appearance on x-rays, what we call a soft tissue density. So sometimes if there's enough fluid built up in that bird, you don't really see a whole lot. You cannot see the heart specifically, the liver, or any other structure. So x-rays, when there's a lot of fluid buildup, they do have their limitations. What the x-rays cannot show us is how the heart is functioning. An x-ray is basically a photograph of the body, so you're not going to see that movement of the heart to give you an idea of how it's functioning. You will not see the heart valves specifically. This takes an ultrasound to see. And likewise, you cannot see the interior of those small blood vessels. So with ultrasound of the bird, ultrasound, it can be very helpful because it does not care if there's fluid present. If anything, it works better when there's fluid present. So sometimes if we know this bird has a lot of fluid buildup in its belly, we'll just skip straight to ultrasound and forego the x-rays because we're going to get more information from this. But we can see those organ sizes and shapes on ultrasound. It can also help us remove other possible causes for fluid buildup, such as like a tumor in there or egg-related disease or liver disease. And based on how the liver wraps around the heart, you can see the heart right on the other side of the liver. So in this little pigeon diagram here, you can see how this is the liver right here, these two triangular brown things, and they snug right up against the heart. The picture doesn't quite do it justice. They actually kind of wrap around the back part of the heart and hug it like a little scarf. And they make a great way of being able to see the heart basically by imaging through the liver. So again, echocardiogram is an ultrasound specifically of the heart. You'll be watching the heart beating in real time. So you can watch the contractions and how strong they are or not. And you can watch the valves function and their structure. You can measure the thickness of the muscle walls. You can measure the valves. You can measure all sorts of parameters associated with contraction of the heart. There's a whole list of things you can measure. Now, limitations to the ultrasound of the heart. The bird has a keel. It's a big old bone, hangs out over the heart, and sometimes this will get in the way of seeing the whole heart. In many birds, you can't see the base of the heart very well on an ultrasound. The base of the heart is where all those blood vessels come in and leave. So you don't always get to see the root of the aorta or where the pulmonary veins pop in to return blood to the heart. The echocardiogram also may require a field trip to a specialist to do. Not all vets have this training, and not all ultrasounds are quite cut out to do a good quality echocardiogram. I, for one, send my heart ultrasounds out to Tufts University because they're the closest cardiologist that is very comfortable working with birds. So this is an example of a bird having a ultrasound. The same position can be used for coelomic ultrasound and cardiac ultrasound. But here's our little blue friend Amazon in an upright position. They're using this little cardboard thingy to just keep those wings kept tucked to the body. And the probe, here's the ultrasound probe in our ultrasonographer's hands. It basically is coming in to rest right behind the keel bone here. We have a muscle wall kind of right in here that makes a nice window to look into the belly. And you can see how they've got it pointing forward towards the head of the bird. Basically, we're aiming for the liver, and on the other side, over here somewhere, is the heart. Now, this is a image I borrowed from another website on what the bird heart looks like under ultrasound. Nice and tiny, and they've got a diagram over here with numbers matching up. So you can see how the right side of the heart, it's right ventricle, right atrium, they're very tiny compared to the left side. And that's because you don't have to pump that blood very far. So it doesn't need to be big. It doesn't need to be muscular. This side is much larger because you've got a farther distance to pump that blood, and you need more blood pumping out. So this side tends to be a bit larger. So the electrocardiogram, as you can see, this is the waveform that I was mentioning earlier. This is a measurement of the electrical activity of the heart. So during the contraction of a heart, you have electrical activity that starts right at the top of your right atrium, and it moves through the heart through a bunch of fibers and such. And basically, this is how you coordinate the contraction of the heart. If the whole heart just squeezed at once, blood would not move terribly effectively. The electrical activity is what allows the atria, the collecting chambers, they pump first to squeeze blood into the ventricles, and then a valve closes in between them. The ventricles squeeze and send blood out of the heart again without sending it back into the atria. So it just coordinates the whole process. The shape of the waveform matches up with each phase of a heartbeat. For example, this little bump right here is the atrial contraction. This guy, this big tall guy right here, represents that powerful ventricle contraction. Any change in this waveform can indicate that there's a problem in the heart tissue that is preventing normal electrical conduction. Now, in veterinary patients, we're often using this to diagnose arrhythmias, so abnormal heartbeats. Birds don't tend to have heart attacks like people do. There are certain changes on an electrocardiogram that you can see in people that suggest a heart attack has happened or is happening. We don't tend to see those type of changes in veterinary patients. Now, with electrocardiograms in birds, many times we do have to sedate the bird, and you'll see why on the next slide. This is not an easy test to do on an awake bird. So here's a human getting an electrocardiogram done. We've probably seen all the medical shows or family members having this done. But basically, you've got all these little electrodes stuck to your chest around your heart area, and those feed into this machine that produces this little tracing here. And nowadays, they've got even better ones that are digital. But ultimately, these electrodes are held on by this little sticky pad, and the wires that go to the machine click onto this little button. With pets, this would involve shaving fur or removing feathers to stick these ginormous sticky pads onto your bird. So yeah, not going to work terribly well with most veterinary patients. So what we use is these little alligator clamps. They've got a flat end so they don't damage the tissue too badly, but as you can imagine, no parrot is going to be terribly thrilled about you clamping like 3 of these onto various parts of their body. So we have them sedated for that. And in fact, this bird here is anesthetized. But basically, it's clamped onto the front part of the wing web here and there, and then the web right in front of the leg, in this case on each side. You can do one with just 3. But this is how you collect those electrical tracings in a bird. So with the indirect blood pressure, this is what you and I are used to when we go to the doctor's office. They stick our arm in a cuff. The nurse puts their little stethoscope against the inside of our elbow or relies on a machine to do it, and then they squeeze us and get our blood pressure. A direct blood pressure involves placing an arterial catheter and using a device to measure blood pressure actually within the artery. Obviously very invasive, so we don't tend to do that unless under special circumstances. Again, we expect birds to have an elevated blood pressure at the vet. Who wouldn't? But there's a limit to how high the bird should get just from stress alone. And once they pass that break point, we will declare that hypertension. And usually, depending on whose range you look at, that's somewhere around 170 and 180 of a blood pressure. Now, in humans, that would be a fairly obscene blood pressure. Our doctors would have taken action much sooner than that. But we expect in our veterinary patients, just from stress alone, they will easily get up to like 160 or so. And this also often requires sedation, because what bird is going to let you put that cuff on their wing and start squeezing them without a complaint? So here's an example of a cockatoo getting their blood pressure taken. You can take it in 2 different places. This picture here shows the little blood pressure cuff on the bird's leg. We snug it up as close to the body as we can, and then we place a little electrode right here to pick up the heartbeat, and we measure blood pressure that way. In this picture, you can just see right here, there's a blood pressure cuff on this bird's wing as well. And when we measure it there, we often have the little electrode right here at the elbow area. Though it looks for some reason like this person is using the wrist area, which is a little interesting, but sure. You can see we've got a little measurement device, just like the doctor's office uses, and it attaches up to that blood pressure cuff. This electrode connects to this machine right here, which is a Doppler. It's used to measure blood flow. And so what happens is, and this is what the nurses hear when they're listening through a stethoscope at your elbow, is we inflate the cuff until you cannot hear heart sounds anymore. Then you slowly release the pressure of the cuff, and you take note to when you start to hear heart sounds again. In people, there are 3 specific types of measurements that they take. In most of our veterinary patients, we're only getting a systolic measurement and not a mean or diastolic pressure. Systolic pressure refers to basically the strongest point of the heartbeat. Diastolic refers to the weaker point, if you will. With what we have for technology and parrots and even many of the smaller mammals, such as rabbits and sometimes cats, we don't get the joy of getting mean and diastolic pressures. We just get the systolic pressure, and we work with it. So with valve dysfunction, moving into the specific diseases now, this is when your heart valve flaps don't seal properly. Normally what happens is when your heart beats, depending on what chamber is contracting, valves will shut to prevent blood from flowing backwards during that contraction, and this forces the blood along its merry way in the proper direction. If that seal doesn't happen, blood will indeed move forward, but it will also be forced backwards through those leaky valves. And when this happens, you end up with basically blood backflowing where it shouldn't be, and this leads to heart failure. Now, there are congenital versions of this where the heart valves just didn't form correctly, and this is things like, aortic stenosis, for example, where the bird is naturally born with aortic valves that are just too tiny, and they don't open and close as they should. Acquired tends to be the most common thing we see, and this is where the heart valves become very thickened and deformed over time. Sometimes you will see structures called the chordae tendineae break. These are supporting cables that help to keep the heart valves from being pushed in the wrong direction during a heart contraction. You can think of them as those spokes on an umbrella that keep your umbrella from flipping upside down during a windstorm. Those are basically what the chordae tendineae do for your heart valves. If one of them breaks, you lose that support, and the valve can flip basically in the wrong direction. With cardiomyopathy, this is a dysfunction of the heart muscle itself. And there are 2 basic forms of this that we'll see. Dilated cardiomyopathy is where the heart muscle basically stretches out and thins, and this causes the heart to become enlarged or dilated. That stretched out thin muscle just can't contract very well, so that the chambers can't empty completely, and blood starts to back up and leads to failure. Hypertrophic cardiomyopathy is where the heart muscle actually thickens, causing the chambers inside to basically get squished and smaller by basically being crushed by all this thickening heart muscle. And when the heart muscle gets thick like that, it also becomes less stretchy, so the chamber can't open up to accept all the blood. Because those chambers can't take in enough blood, nor can they contract very well, you again end up with heart failure. And this is one of the common versions we'll see in cats, is the hypertrophic cardiomyopathy. Dilated, we tend to think of it as a dog problem. Certain breeds are prone to it, and you may have heard all the hullabaloo about potentially dilated cardiomyopathy being associated with the grain-free diets in dogs. We do occasionally see the dilated version in parrots. Not terribly common, but it definitely happens. I can't think off the top of my head of a definitive hypertrophic cardiomyopathy diagnosis in a bird, but I'm sure it's been found somewhere. So whether it is a valve dysfunction or muscle dysfunction, there's no way you can tell the difference on a physical exam which it is. You do need to get some diagnostics. X-rays can show chamber enlargement, but they can't always distinguish if it is dilated cardiomyopathy versus just significant enlargement of the entire heart due to valve dysfunction. Sometimes you can tell the difference, but not always. And generally, echocardiogram is necessary for that diagnosis. All right, so with our x-rays of bird here, here's our normal African gray here on the left. This structure right here is kind of wedged to heart-shaped. That's our heart right there. You see how it narrows as we kind of reach the point of it. And this right here, this little triangular area here, is the liver that wraps around the tip of it. This is what you're supposed to see in a bird. And this is an African gray that I'm currently working with. You can see the difference pretty easily. And what you see is, number one, up where that heart is supposed to live, we don't have that lovely triangle shape. If anything, it's kind of a giant blob. And notice how much bigger it is. When you compare, say, draw a line here and compare how much of that line is occupied by the heart versus open chest space, there's a huge difference between my patient here and this normal African gray. That heart is huge and globby. You can also see how it looks like the liver is also quite enlarged, and you can't make out anything back here. Is this sea of white gray material? Whereas a normal African gray, you can see up here's where the liver ends. Here's our ventriculus or a gizzard right here. Here's all this open airspace. You don't have that in poor little Plato here. These are little surgical staples. I forget exactly what she had once upon a time, but she did have some surgery on her booty area years before I met her. So here's our normal African gray again. This is the heart right here, and this space right here, this is where the liver is, just curling around the back part of that heart. You can see the lung tissue up here. It's just this faintly speckled area. This is the esophagus going into the proventriculus, or going into the gizzard, the ventriculus. And here's our little spleen, kidneys, intestines, vent. Then there's Plato. And yeah, where is that heart? You cannot see the heart very effectively. You can't see the liver, nor can you really see the kidneys or anything else. Even those open air spaces are completely filled with this, what we call soft tissue density. Could be organ, could be fluid. Can't tell by looking at it, but it's awfully suspicious. Also notice how you really start to see this very, what we call reticular pattern of the lungs here that you don't really see on this gray here. This is basically fluid buildup inside the lung tissue, and it's highlighting all those little airways that should be filled with air instead of fluid. So now next we have, now these are all stolen human images. I was having trouble pulling the videos off of our ultrasound machine, so you'll have to forgive me for substituting humans. At least it's still a 4-chambered heart. But this is an example of a series of normal images from an echocardiogram. So on the bottom here, you're going to see this is the pumping chamber, the ventricle here, and this is the valve that opens up into, from the atrium down at the ventricle, and go. But you can see how the valve pops open, closes shut. It's nice and open when it does, and it seals shut nicely. This is where they're using some color flow technology to watch where all the blood is going. This is the heart in, start that again. So that section we just bumped away from accidentally was the heart and cross section. So you're seeing the chambers cut from side to side, and pay attention to how nice and strongly they contract. So a nice squeeze there. This guy in the center, this is your left ventricle. This little fella is your right ventricle. But notice how they're squeezing nice and tightly with every beat. And likewise, a nice little ventricle and atrium here. Other ventricle, other atrium. And you're watching those valves just pop open. Okay, and now this is a bird. No, this is a human with dilated cardiomyopathy. You notice how sad that contraction is compared to the other images we just saw. No, get back there. Let's play that again. So that muscle is barely contracting and moving. Now, the African gray I just showed you a moment ago, her heart was basically doing the same thing, just at a really much faster rate. So that bird, we'd end up diagnosing with dilated cardiomyopathy. Now, this one is an example of a valve that doesn't work. And the valve in question we're looking at is right here. Now, remember from the last slide, a couple slides ago, how this valve pops open, stays open, and then slams shut. Here we go. Look at this thing. It's like clapping hands. It just kind of pops open, but it doesn't stay open very well. And basically, this thing is allowing blood to leak backwards and forwards instead of sealing.
And this is what.
So the treatment depends on the exact diagnosis. It'll depend on whether it's a heart valve misfunctioning or if it's your muscle misfunctioning, exactly what type of misfunction it is. Many times we rely on a drug called pemobendin, And this is a drug that helps to strengthen your heart contractions. So this one we commonly use in creatures with valve dysfunction. We also use it in creatures with dilated cardiomyopathy, where the heart just can't contract. You do not use this stuff for hypertrophic cardiomyopathy. The last thing they need is heart that squeezes even harder. Drugs such as furosemide or Lasix are used to reduce fluid buildup within the body. Other things that can be done to remove that fluid include what's called the salomocentesis, which I did not list here. And this is where you basically place a needle into the belly to suck out as much of that fluid as you can. This results in very immediate relief to their breathing. They can finally open up their airways without that fluid present. And tends to make the bird feel overall better. You can also take that fluid and do some testing with it if you need to. Drugs such as enalapril are sometimes used to basically keep more blood resting in the veins safely, which means less blood going to the heart, so the heart doesn't have to work as hard. Other drugs such as spironolactone also can help to reduce the fluid buildup. It also limits your potassium loss. Spironolactone is not quite as strong at removing fluid as furosemide, so it's not often our first weapon, but it can be used because furosemide has a nasty side effect of causing you to lose a lot of potassium in your urine. This is where the blood work comes in handy, as we can watch those potassium levels, and as they start to drop, we will add in drugs like spironolactone. With drugs such as hypertrophic cardiomyopathy, you may pull in drugs such as atenolol, which slows down the heart and allows the heart muscle to relax just a little bit more. In general, with any sort of valve or muscle dysfunction with the heart, the prognosis for the long term tends to be poor to guarded, meaning the bird is going to die of this disease eventually. It's just a matter of how far we can stave it off. There's a lot of data out there as far as how long we can expect. In dogs, once they start to go into heart failure, these days, the prognosis is anywhere from 6 to 12 months of control with medication before they start to require rescue medications and start to succumb to their heart failure. Birds usually are not that fortunate, but those that respond nicely can sometimes respond for quite some time. The bird I was showing you the x-rays of, little Plato with the dilated cardiomyopathy, we are now 6 going on 7 months in, and Plato is still doing fantastically. She's only needed 1 fluid removal with a needle, and the medications have been taking it from there perfectly for her. And she's still playing. She's doing Play-Doh things and yelling and taking her medications like a good bird. We're expecting disaster any day, but so far so good, knock on wood. Atherosclerosis, I would say, is probably the most common disease we'll see in birds related to the cardiovascular system. And basically, this is cholesterol plaques within the blood vessels. In humans, it is most commonly the coronary arteries that are affected. The coronary arteries are the blood vessels that bring blood to your heart muscle. And this is why humans have heart attacks. When the vessel gets too clogged, your heart muscle is deprived of blood flow, and that's what causes the heart attack. And you can develop strokes when pieces of these plaques break off. This picture here shows basically how they start to form. In the later stages, you can actually get blood clots developing along with those plaques, and those plaques and blood clots shearing off and breaking off are what lead to strokes. Thankfully, we don't tend to see those kind of strokes terribly commonly in veterinary patients, including birds. You will hear of yolk strokes, where, say, a egg-laying female is just so eggy that her bloodstream is starting to fill with fatty acids and such. And there are some reports of basically yolk material somehow getting access to the blood vessels and causing strokes. Now, with atherosclerosis in birds, the arteries leaving the heart are the most commonly affected ones. So this will include the descending aorta, which brings blood flow to the back half of your body, and your pulmonary arteries, which are bringing blood from the heart to the lungs for oxygenation. The signs really depend on what body part is being deprived of blood flow at that given moment, and the signs can be quite vague in parrots. For example, those of you who follow football, collegiate football, Auburn University has an eagle. They fly over the football stadium before their games, a bald eagle. And one of the challengers, as the birds are called, during a football game and during his flyover, he misnavigated and slammed his wing into the goalpost doing his flyover. And ultimately, it turned out that that bird had atherosclerosis. And he was basically had minimal blood flow to that wing at the time of the incident. And that's why he flew into the goalpost, as he literally couldn't control that wing very well. Our parrot friends will often present as, weak on the perch. They may be falling off. It may be that they have difficulty using their feet because their feet aren't getting enough blood flow. And I've had one where feathers are falling out because the feather follicles weren't getting enough blood flow. Now, there have been some studies looking into this in birds. There are several risk factors that are involved here. For example, species. Amazon parrots, by far and large, are the most commonly diagnosed with atherosclerosis, followed by the African greys and the cockatiels. Now, this may or may not represent true species tendency toward this. These are also 3 of the most popular species that are kept as pets. So this might just represent their popularity and not a true tendency. Age is a risk factor, much like with people. Middle-aged and older birds are more prone to developing atherosclerosis. Other factors they found in this study that were female birds were more prone to it, which is not what we often think of in humans. And it's thought that their egg-laying cycles may have a role in this. And interestingly, birds that tested positive for chlamydia psittaci were more likely to develop atherosclerosis. Why this is not clear. They're not sure if this is just a weird association or if there's a true connection here. Of all those risk factors, there's not a single one I can control. I cannot control your bird's species. I cannot control their age or their gender. Diet was the last risk factor that they found, and this is the one we have the most control over. As you can imagine, much like with people, those with higher fat diets tend to be more prone to heart disease. Basically, your seed-eating birds or birds that ate way too many nuts. So again, the signs can be very vague depending on where the obstruction is located and what body part is being deprived of blood flow. This makes the diagnosis very challenging. Other things that make the diagnosis challenging is that X-rays are not necessarily the most helpful here. It is our main way of diagnosing it in private practice, though. And what we're looking for is arteries that are more dense or larger than they should be. There's no correlation between how dense that artery looks on an X-ray and how severe the obstruction is. So I can't look at an X-ray and say, yes, this artery is at 80% obstruction and this one over here is 40%. All I can say is, yep, that's denser than normal and it's highly suspicious. CAT scans, CT scans tend to be more sensitive to detecting atherosclerosis than X-rays, but they're not perfect by any stretch. They miss lesions too, and of course they're more expensive and not everyone has a CT scanner handy. More recent studies have shown that the PET scan, and this is basically a radioactive isotope scan, are even more sensitive than CTs are for detecting atherosclerosis. I believe it's a radioactive fluoride ion that can be injected that will attach to calcium deposits within these obstructions. But as you can imagine, these are even harder to find than CT scanners, and that at the moment they can be buku bucks. In humans, often you'll look at cholesterol levels, triglycerides to determine your risk for developing atherosclerosis. But in parrots, these values have not been shown to correlate very well with the presence of atherosclerosis. They're not even consistently elevated in effective birds. Those of you familiar with our boarding area probably know and love Larry, the macaw that lives right on the corner there. We diagnosed him with atherosclerosis several years ago. And part of his workup, we did submit the full cholesterol panel, HDL, LDL, etc. His values are all perfectly normal, despite what we see on his x-rays. So this is an example of a, cardiovascularly normal parrot. Obviously, little Lucy here is not normal. Look at that belly. She's an egg-laying girl. This is an eclectus parrot that's owned by a former employee of ours. And she's the one I selected to be kind of our not so normal. And what we're looking at here, here's her heart right here. And you can just see this little white line heading back here. I'm tracing it with my pointer here. That's the descending aorta, the big vessel leaving the heart and bringing blood flow to the back of the body. What I'd like you to notice is that those margins of that vessel are not terribly distinct. You can see where it is, but it's not very crisp. And you start to lose sight of it kind of in here. You can't follow it all the way back to say her kidneys, which would be right in here. Now this coming up, this is a parrot. This is also an eclectus owned by one of our current staffers. And what you'll notice with him is that you can trace that artery very well. Look how crisp and defined the margins are on that artery. And you can almost follow it back to his kidney. With Larry, whose x-rays I did not include, you can easily trace this all the way back to his kidney. And this is what atherosclerosis will look like on an x-ray. And this is, in the grand scheme of atherosclerosis, not even the worst lesions we've seen. Now, interestingly, this is a male parrot, and he's hardly ever seen a seed in his life, and yet he has these changes. So there's obviously more to the story and the development of these that we just are unable to detect at this time. Me and Dr. C, our theory is that it might relate to the fact that our parrots are not flying for miles a day like their wild cousins are, but that's really a hard thing to measure quantitatively in research. So I don't know that we'll ever get a definitive answer in our lifetimes on how much of a risk factor that is for the development of atherosclerosis, but we gotta wonder. So with atherosclerosis, if you were a human, they'd be talking about doing bypass surgeries with you or putting stents in your arteries to prop them open and allow more blood flow through. These are not feasible or available for birds. We're talking about major arteries leaving the heart. So if something goes wrong with stenting that, the bird's going to die right there on the surgery table. And likewise, bypass is just not feasible. And if it were, I'm sure it would be like a 5-figure surgery, which, as much as we love our birds, that would be a challenge for most bird owners. So we rely on medical treatments, and these medical treatments are focused on getting blood flow past those obstructions a little bit more easily. Isoxaprine has been one of our mainstays of treatment, and this, in various case reports, has been found to be very helpful. And what it does is basically just relaxes those blood vessels, lets them open up a little bit more so that more blood can squeak past those obstructed areas. Pentoxifylline is a second medication that has similar effect. It works a little bit lower in the blood vessels, so not as close to the heart, but has a similar effect of letting blood flow through. Isoxaprine has been a bit more challenging to get our hands on lately. It used to be that most compounding pharmacies would carry it for us. Now we're just limited to like one or two. I think Wedgwood and maybe one other will make this for us. So we've been relying a little bit more on pentoxifylline for some of our patients now. Both of them seem to be effective. Both of them are very well tolerated by the parrots, and they've got a decent dosing regimen where we've got a wide range of doses. We can do it once a day, twice a day, as the bird needs it. Now, given that diet is a huge risk factor, diet improvement is often a big part of our treatment plan. Now, getting the bird off of seeds and onto something healthy isn't necessarily going to make those plaques go away. Once they're there, you're stuck with them. But our goal is to prevent more from building up. Omega-3 fatty acids have been looked at for human cardiovascular health as well as animal health. There is a wonderful study out there in cockatiels looking at the effect of a couple different fatty acid supplements. I believe they look at flaxseed oil, fish oil, and one other oil that I'm blanking on right now. And they looked at various blood work markers for inflammatory response. In the study, they found that the fish oils actually produced the best response in the cockatiels they looked at. But it was also the way they did the study, they incorporated those omega-3 fatty acid supplements into a specially formulated diet. They got together with the folks with Rowdy Bush, I believe, to make pellets with these oils in them. As you can imagine, the cockatiels were not thrilled about eating fishy flavored pellets. So palatability was a problem. The flaxseed oil pellets were better tolerated by the cockatiels. It didn't have as profound of an effect as the fish oils did, but at least it was better tolerated and it still had an effect. So a lot of folks will recommend flaxseed oil. Exact dosage is still being worked out. We have not determined yet the optimal dosage, but we generally will give some. Our house parrots, such as Larry, we actually found it's a fish oil, but we poke a hole in the capsules it comes in and squeeze a drop onto his NutriBerry. He happily eats what we call his poison berry every day, and he has no idea there's fish oil on it. There has been a lot of research looking into the statin drugs, such as Lipitor, for their effect in preventing atherosclerosis and managing fatty acid cholesterol levels in birds. The efficacy has been quite questionable. There have been studies where there were not measurable plasma levels of the Lipitor or other drugs in the bird's bloodstream, or they didn't really see that much effect on the bird's cholesterol levels on these drugs. So right now, the data doesn't really support using the statins in managing this disease in birds. The prognosis is quite variable. There are some, like Larry and others, that have lived for years with this disease with treatment. With Larry, the only clinical sign he ever gave us is that just one day our kennel person caught him breathing harder than usual while standing on his perch. That's the only thing he gave us. Our technician's Eclectus parrot, he tumbled off his perch one day. It was the only time he ever did it, but there you go. There are some that will just die suddenly or are euthanized due to poor quality of life. And again, it boils down to what blood vessel is affected and how badly. There are some that no matter what you throw at them, you're not going to get a blood flow past those obstructions to make it different from those birds. Or it might be that their poor little brain is deprived of blood flow at the wrong time, and a brain without blood flow is a brain that can die very quickly. Now, with hypertension, like with people, this is an increase in your systemic arterial blood pressure, and it can result in organ damage due to basically just too high a pressure traveling through your tiny blood vessels. And so it can lead to things like organ damage, like your kidneys can be damaged by hypertension. Your liver, your retina can also be affected due to that high pressure. And we can see this in parrots all by itself or in conjunction with other diseases such as atherosclerosis. For example, the heart may have to pump blood even harder than normal to get it past all those obstructions. And on the other end, you can see elevated blood pressure as a result. Like with people, again, the signs are not always apparent until they're really severe, such as blindness, spontaneous bleeding, or in blood work, you may see evidence of kidney injury. This is diagnosed by indirect blood pressure measurement, like we saw several slides ago. Other testing can be done, such as x-rays and blood work. They're not going to tell you a thing about the blood pressure per se, but it's helpful to help rule out other causes for the increase in blood pressure, evidence of other organ damage and concurrent diseases before we put them on medication. The most common treatment we use is a drug called amlodipine, which is also, I believe, used in humans. And there are other blood pressures measurement. Good grief, I cannot talk. Blood pressure drugs out there. But amlodipine tends to be very well tolerated. It's been around forever, and we do have some good solid data that it seems to work, so we rely on it. Humans might be told to avoid excess salt intake. The effect of salt restriction in birds in response to hypertension has not really been explored just yet, and it's not like we tend to encourage them to eat salty things or the like anyway. Their diets are pretty salt restricted as is, but all the same, maybe don't share your potato chips with your bird. So in terms of how do we prevent all this stuff from happening, so far there isn't a ton of data telling us what we need to avoid in order to prevent these problems. That said, the one thing that seems to have the most power over preventing some of these issues is diet. And this is one of the many reasons we harp on all of you about diet with our parrot friends. In atherosclerosis, there has been that association with a high-fat diet in research studies. So converting them on to lower fat diets, such as the pelleted diet, supplemented with fresh veggies and a little bit of fruit, is definitely a step in the right direction. In dilated cardiomyopathy in other species, such as cats, there's been an association with taurine deficiency. This is why all cat foods these days should be supplemented with taurine. And likewise, there's not been an association that we've noticed with, say, grain-free diets and dilated cardiomyopathy in birds like we have seen in certain dogs. And if anything, many of our birds left to their own devices, may eat a fairly heavy grain diet, and they don't seem to. So there's not much drive to put birds so far on a grain-free diet. Omega-3 fatty acids, by their anti-inflammatory effect, and they tend to mitigate elevated cholesterol in humans. There's a possibility that they may have a protective effect for heart disease in birds. Data is still coming in on that, but it's not a bad idea to say consider a flaxseed oil supplement with your bird. And if anything, careful monitoring of your bird. We may not necessarily be able to prevent all these diseases, but the earlier we can catch them, the better the outcome can be. We may actually be able to offer more to help the bird if we can catch this before it's really, really bad. So if you can even, start taking notice of your bird's breathing rate, maybe catch them on a perch in a quiet moment and just count how many times they breathe in a minute. And do that here and there, and you'll get a feel for what their normal is, so that someday if there's an elevation in this, you'll know, because, hey, I count my birds' breaths every now and then, and this is what's normal for them. This is not normal. Or this is how much their keel moves when they breathe. This is how much their tail moves. And now I'm seeing more of this. So that basically is a wrap here of the most common cardiovascular diseases we see in parrots and how we diagnose them and treat them. And certainly if you have any questions about what we covered, I know we covered a lot of territory, and I tried to condense some very dense and boring cardiology into bite-sized pieces for you. So if there's anything I didn't explain terribly well, please let me know. Thank you.
Thank you, Kristin. That was quite educational. Would you mind putting the first slide, your cover slide, up for just 1 second so I can grab a screenshot?
Voila.
There we go. Okay, you can turn off sharing. Thank you. Okay, we'll get everybody back on screen again. That was a lot of information. I know I have a ton of questions, but would somebody else like to start us off? And raise your hand or just start speaking. And if not, I will ask some questions.
Woohoo!
I had no idea that you could measure blood pressure and EKGs in birds. Oh, it's looking at the size of a the contacts you put on a human. I thought we do that on a bird.
Yeah.
So it's quite interesting that you got. So you can get a full EKG. You have multiple leads, and that's just that kind of blows my mind.
Yeah, the cardiologists tend to have like the full 6 leads set up. Most of us out in private practice have like a 3 or 4 lead setup, but still get a decent measurement.
Right, and at least you get a rhythm strip. So that's just amazing. The same thing with the blood pressure. I was wondering how we were going to do that.
Tiny, tiny cuffs. And there are some like a budgie, it's just not going to work. The cuffs don't come tiny enough. I'd say probably something like the size of a Senegal or something, or maybe a Kaik is probably the smallest bird we can get a reasonably accurate measurement in. And smaller than that, they just don't have cuffs the right size.
April says she purchased isoxaprine from Mixed Lab.
Oh, perfect.
Yeah, I have one of my birds is on he's on several meds now, but he's on allopurinol from Mixed Lab. It's in this horrible oil. It gets everywhere. His feathers are all matted.
Yeah.
I just now got a formulation from Wedgwood that's in it's almost like a waxy substance, but it's water soluble.
Okay.
They whatchamacallit, they use for soap, glycerin. It's in glycerin based.
Okay.
And if that doesn't work, then they'll mix it up for me at the bed in water. It's harder to guarantee that it's evenly dispersed, but
yeah. Even disbursement and the shelf life, I guess, is longer with the oil-based suspensions, which they try to do so people don't have to order as frequently. But yeah, it is messy. It wipes the printing off the syringes easily. It's just gross.
It takes the printing right off the syringes. So the syringes 3 or 4 days, and then the numbers are gone. So it's just the oil's disgusting.
It's not popular, but understandably, nobody wants to pay extra to get the aqueous solution that's guaranteed for a month and a month only. So, catch-22.
Right. Well, I have talked about several of my birds. So, I had a cockatiel, Misty, came from a pet shop before I knew better. Started off with worms. She was always sick, and chronic egg layer, ended up with a hysterectomy, and then she was bleeding a lot afterwards, so we realized she had liver problems.
Oof.
She died at only 6 years old. Not really sure why. She had some horrible infection. She was having. I got a necropsy. Full page of things that were wrong with her. But what stuck out to me was she had severe atherosclerosis, and she was only 6 years old. So how happened? A 6-year-old cockatiel to have severe atherosclerosis. That wasn't the apparent cause of death, but is that from poor breeding? I said she came with worms, came from one of those breeding in Florida. Was it just that she had bad genetics and was predisposed to getting atherosclerosis?
I mean, we definitely do see some genetic links in humans where certain families are more prone to it, even with a healthy lifestyle. I mean, one of my obstacle running friends ended up having a massive heart attack, and he ate healthy, he ran miles a day, and yet he was genetically predisposed because that was what his dad was like. I've got to imagine the same's got to be true in birds. I too have seen birds where I've done the necropsy on this, I can't remember exactly how old the sun conure was, but I think it was upper single digits. And yeah, it had like a 50% blockage of its aorta. And that's the only thing I could find wrong with it. The Eclectus Dallas, I mean, that's my surgery technician's bird. And she has had this boy since he was shipped up from his breeder, freshly weaned. He has been on pellets his whole life, and vegetables and fruits, and she exercises him. And well, we all saw those x-rays.
Yeah. Yeah, as you said, I mean, we all know humans that died young, the same thing. They were vegans and ran 5 miles a day and healthy.
Absolutely.
They drop dead when they're 40 because it's just genetics.
Yeah, and I got to wonder, how much are we affecting their hearts by them not flying for several miles a day to do all these things? They're lucky if they fly, 100 yards a day.
Yeah. I'm sure that's a major factor in heart disease. Well, so I had another cockatiel I adopted, and when he was 20, went into florid heart failure. I came downstairs, wings hanging down, trouble. I got him down to the vet immediately. He wasn't healthy enough to do any x-rays. They didn't have an echo back then down there. And it was filled with fluid, and we thought he'd be dead in 24 hours. Immediately started him on Lasix, on an Alpril, and I forget what the third medication was. And the vet was sure he'd be dead in 24 hours. She called me the next day and said, well, he passed, right? And no, and he just gradually improved. We took him off everything except the Alpril because we were afraid to be honest. Yeah. It lasted another 7 years, and then he died of strokes over the course of a weekend. It was just multiple strokes till he died. So what we were wondering, because if it was a dilated cardiomyopathy or hypertrophic cardiomyopathy, he should not have lasted another 7 years. And he was healthy as could be once he got over this till last weekend when he died. So we were wondering if it was a viral cardiomyopathy. I always like to tell people, like the movie Beaches.
Yeah.
Did he have a viral cardiomyopathy? We got him through it, got over it, and then was healthy for another 7 years. He always did have a murmur. He had a murmur when I first adopted him when he was like 16 or 18 or something. So there was always a heart murmur. But he never had a problem again after that horrible episode.
Yeah. Yeah, something that definitely could use some investigation. I'm not aware of anybody noticing any definitive signs or suggestions of viral infection on necropsies of birds with heart disease, but it may just be that, maybe we're not looking closely enough maybe we should be busting out the electron microscopes, or maybe it's something like with COVID where the disease strikes, causes the problems, and then goes away and leaves us with the aftermath, and we just can't detect it from the aftermath yet.
It was just, you talk about birds, how long they live after these things, and it was just unheard. I mean, it was astonishing how well he did after that episode that he should have died from. If I hadn't that immediately they slapped oxygen on him and were pumping beds. I mean, another hour or two and he would have been dead.
Oh, I believe it. I mean, that that Graham patient of mine, yeah, we weren't sure if he was going to make it through the night, and yeah, 6 months later, you would hardly know that I pulled gobs and gobs of fluid off this bird back in September. Something like
Amazing.
that.
Because you were saying that's unusual for birds to have strokes, but I had two cockatiels died at age 27 of strokes.
Yeah.
They were
Yeah.
very clear strokes.
Yeah. At least not like we think of with people where like blood clots break off or pieces of the plaques break off. It doesn't tend to be very well documented. Not to say it doesn't happen per se, but at least just we've yet to have major evidence of it, at
Interesting.
least that we can document on a necropsy.
Yeah, and they both lost the ability to walk and to move.
Yeah.
Yeah, it was the legs that were first affected in both of them.
Hmm.
Did have a necropsy on the second one, but they don't do the brains. So it's trying to determine if a bird had a stroke. It's not like we have an MRI of the brain, like we
Right.
do. And they don't even dissect the brain during the necropsy. So, they list everything else, but it's very apparent to me that he died of strokes, but
Mhm.
necropsy doesn't even address that.
Yeah, it's just so difficult to get their brain out intact with those tiny little structures and how much you have to break through the bone to get there, and it deteriorates so quickly after postmortem as well that sometimes it's just not the juice is not worth the squeeze, as they say. And I wonder sometimes with the folks that mention to me strokes with their birds, how much of it is a true stroke versus like an atherosclerotic ischemia, where yeah, we're just not getting blood flow, but it's not because we had a stroke; it's because that's where the obstruction is. I don't know.
Interesting. So yeah, so it would be peripheral, not central. But
Right.
how would you even determine? I mean, it's
Yeah. Like I'd be curious to see like some angiograms on these guys, but
I don't do an angiogram on a creature. I mean, maybe on a big macaw, but not on a
yeah,
little.
yeah, there's like a budgie or a cockatiel that would be very difficult. But yeah, macaw, no problem.
Yeah, I'm just astonished listening to your talk. I had no idea that we could do some of these tests on little birds. Uh, the science has advanced so much.
Absolutely, every day.
I don't know how many of the vets have these tools. How many even the avian vets, because the tools
Yeah.
are expensive.
Yeah, I mean, most of us do have the equipment to do a blood pressure, no problem. Um, with the ECGs, the electrocardiograms, those get a little bit more challenging. The best what we have, and it's not perfect, is we've got a surgical monitor with the ECG included in it. The waveforms just don't get detailed enough with tiny creatures to make definitive diagnoses on them. If and that's another thing that I will send a bird to Tufts for, is to get a very detailed electrocardiogram, because they still have the paper printout ones that pick up the very finest of details that my surgical monitor just can't.
Yeah, one of the other problems, and I'm sure we've all experienced this when you go to the vet and your bird is sick, that's when they don't want to do the test because they don't think the bird can stand up for it. So that type
Exactly.
of, for example, could have you an X-ray would have been really helpful.
Hmm.
Like my bird that was in heart failure.
Yep.
They're too sick to undergo those procedures because it's not like us, go stand in front of the X-ray machine or to put the
Yep.
echo. The birds have to be sedated or anesthetized or
Manually restrained and
put in a box or something. So, I have birds that haven't had blood work in years because they're elderly and it's been too
yeah.
stressful. So how do you even get tests like this on a bird that's sick with heart
Like
disease?
yeah, my gray there. Our first step was actually just skipping straight to the salomocentesis. We pulled the fluid off first, just for the sake of getting this bird breathing better.
Yeah.
Those X-rays I showed were actually after the salomocentesis. Once we had drained her as best we could, and even before then, I'd put the probe on her belly, knowing that I'm going to see more because of whatever fluid is left behind. And we, I believe, waited until the next day when Plato was more stable to even think about a blood draw. So we stage it out. We pick and choose the tests we think will be the most fruitful for us. And sometimes we skip, like here, straight to a therapeutic intervention before even moving on to the diagnostics for the sake of the bird.
And little birds, the blood draws harder because you're taking a larger proportionate volume of their blood.
Yep.
So, and a little bird who has any sort of illness or is elderly or doesn't recover well from blood draws, it's just like than doing a macaw.
Yeah. Plus, it's a more stressful event. And those little birds, the only location we can draw from is the jugular. That's scary. It requires more handling. Whereas a big old macaw, I can tap it out of a leg vein and put a band-aid on them and set them down. Easy peasy.
Oh, so I didn't realize that because I've only had small, well, even my cockatoo, they do the neck vein.
Yeah, you can get larger volumes, but I like the leg vein because I can usually get what I need out of it, and I can put a band-aid on it and let the bird go and de-stress. Whereas with a jugular draw, you've got to hold them for a moment, keep your pressure up, and that's just those extra few seconds of stress.
right, right.
I have a question.
Yeah.
What would the dose be for the omega-3 fatty acid for a African gray?
Basically some. There's not really an established dose yet, so
Okay.
with our blue and gold macaw Larry, we just squeeze a big old drop out of the capsule of omega-3 fatty acids.
Okay.
So probably like a drop on food a day.
All right.
A food item that they'll eat. With Larry, we put it on his NutriBerry. You
Right.
can put it on whatever the bird will eat happily.
Okay. Thank you.
problem.
Dr. Monaco has given flaxseed oil for my cockatiels, and he has it's a little TV syringe, 0.05 per bird. So it comes out to like
Yeah.
2 little drops per cockatiel.
Do the birds like it, Steph, or how do they react to it?
Well, I put it on their morning chop, and they're so hungry in the morning. It's just mostly some cooked vegetables and some Tuscan Dream or whatever those things are that I've extra cooked. So they just eat everything. I don't think they really care that much that the 2 drops are on it.
Yeah.
They're pretty good. They just eat their food. So
Yeah, with the cockatiel study, they were aiming for a certain content, fatty acid content of the food that they were eating, but they weren't measuring per se exactly how much each cockatiel ate. So,
Dr. Sinclair,
yes.
I give my bird about 2 spoonfuls of oatmeal made with almond milk, but
Okay.
in it I put a ground flax seed
Okay.
and chia seed in it just because I have it, and
Yeah.
then she gets some of that. I don't know if that's going to be beneficial or not, but that's part of her diet every day.
Omega-3s and fiber.
So should we be putting all our birds on omega-3, you think?
I mean, it probably wouldn't hurt. It's just a matter of whether the bird will accept it or not. The flaxseed definitely has a better palatability behind it. So if you were going to do it, I'd use the flaxseed oil. For some, the texture might throw them off a little bit. They might not enjoy the oiliness of it. Your experience may vary.
Are there other formulations other than oil?
Most of the work has been done looking at the oils specifically. You could potentially just offer them the flax seeds. I think they're relatively tiny, so they may not be the most appealing things to all but the smallest of parents.
I get them ground.
Yeah.
And then just put it in her food, and she's fine.
Yeah, I keep it handy for baking, and yeah, I could see how you could sprinkle that on some food.
My African gray Rudy was diagnosed with atherosclerosis last year, and the reason I knew there was something wrong because he stopped talking, and he started standing at attention. So when I took him into the vet, I explained it all. We did the tests, and sure enough, it was. We put him on medication, but I must tell you, it made him worse. I can't tell you the name of the medication because it was compounded. And after a while, his whole self did not improve. And then one day I thought I was a like a I had I knew that something was not right, and I thought I was going to have to bring him in, and that would be the end of it.
Yeah.
Um, so the story is, and I'll do it real fast.
Yep.
As I was taking him up to the vet, I was singing, and I was telling him what a beautiful day it was. And it was a day that I had many, many years ago where it was a beautiful sunny day. And I said to him, um, look what a beautiful day we're having. And as I was talking to him and we got to the office, the vet was with another client and said, come on in. And I said, no, we're not coming in. We're going to sit outside in the sun. And I opened the cage, his carry cage, and I sat him on my lap and I said, look at what a beautiful day we're having. And I said, look at the ocean. Feel the sun on your body. And I spoke with him in a way that if you were a spirit that has left this world, you would be right there with us. And we brought him in about 20 minutes later, and she looked at him and she says, he's not going anywhere.
Hmm.
Okay. Now we took him off the medication.
Okay.
I'd already improved his diet,
Okay.
and he talks up a storm,
Nice.
and doesn't mean he's not sick,
No, not at
but
all.
I'm treating him like I always did.
Yeah.
And I believe I had a miracle. I believe we had a miracle. I really do. I'm not saying he's not ill, but he's not as awful as he was when I first took him in. And then with the medication,
Yeah.
it's a completely different situation now. Even though, his diet, we're careful with his
Mhm.
diet, and
Yep.
he lives with other birds, so he's not an only bird. So
Yeah.
everybody gets the same thing. I mean,
Yep.
fruits, vegetables, and extra stuff that I believe will not harm them but help them.
Yeah.
So I'm just saying that good things can happen. And for him, he's only going to be 23. And so that's how I look at it. Now I did adopt. And so he's talking. And he's playing.
Yep.
And I kept him in a wellness cage for several months, and now he's back into his own house, but I've got the bottom covered.
Yep.
I adopted a Senegal. This Senegal was dropped off at a sanctuary. He is 35 plus years old. When at Fine Feathered Friends, when they realized something was really wrong, she took him to the vet. And yes, he had had strokes and he was shaking. And I can't even tell you what kind of food he had. I didn't know she had him at the sanctuary. And I asked her one day what type of bird she had. And she explained that Jackie, excuse me, um, was a survivor of strokes.
Hmm.
And so I went down to see him. I could see that he was bobbing about. And I said, okay, because I have another Senegal that's um, elderly and she's just fine. And she talks up a storm. So I said, can I bring him home? And she said, yes. And ever since then, he doesn't, he does bobble a little bit.
Hmm.
He's probably been in the same cage for 35 years.
Yeah.
I won't change the cage. None of the toys, I might change a toy, but it's the same toy.
Right.
I feed him fresh food every day, and he eats and eats and eats. And he does go to the bathroom. He does bobble a little bit. He lost his voice, but he does respond in a sound or two.
Okay.
So regardless of how long I have him, it's a better life than what it was.
Absolutely.
And so that's how I've been looking after birds now for a mere 25 years comparatively. But when I look at from here to here, I've had 17 birds,
Yeah.
and throughout the year, the ones that I did adopt, all of them are adopted except my very first parrot. I knew that they had issues, And for whatever length of time I had them, my husband and I gave them their best. So I love, Dr. Sinclair, what you're saying, because I feel like at times we feel like a failure, and yet miracles do happen.
Absolutely.
And if you have a good avian vet or a good board certified vet, a real vet who loves birds and who can work with birds, you've got everything.
Yeah, absolutely.
And
in there.
fresh food, fresh water every day, and the cleanest cage you can give them, and a little flying, et cetera, et cetera. So good things happen, and Gayla and I know each other very well, so she knows what I'm saying is true. So
Absolutely. Good
that's
food.
why I'm on here today, because of this very topic.
Oh, I appreciate that. And yeah, everybody responds differently to treatment. And there are some drugs that, even though they work for everyone else, don't work for everyone. And there's a lot to be said for, good food, good water, good loving.
That's right. That's right. So I just wanted to share that with everybody. And miracles.
Yeah,
Absolutely.
I have a question.
Yeah.
Are there any large studies looking at this topic, or are you guys in the trenches pretty much on your own?
Most of the work has been done with cholesterol and atherosclerosis. There's a specialist that formerly in Canada, now at UC Davis, has been spearheading a lot of the research into cholesterol levels, the statins, and atherosclerosis in general in parrots. And with that being probably the most common thing we see, thankfully that's what we got the most research on, but it's still very much in its infancy, where we can't, take everything he's presenting us and apply it to all of our clinical cases. But he has found out some interesting things that have been helpful. As far as like the valvular dysfunctions and such, those tend to be more sporadic in nature. So a lot of that is still, we have this bird, we tried this treatment on it based on what we see in cats and dogs, and XYZ happened. And based on that, we suggest you do 1, 2, and 3 with your patient. So, and some of the stuff just doesn't even get published, where I'm sure like the cardiology at Tufts has managed enough of these that they can say, hey, I've dealt with 10 of these from the exotics department, and this is what happened, so this is what I suggest to you. So the answer is yes and no.
Thought you were going to say that.
Yeah, I wish.
I can mention one other interesting case that every one of my cocktails has had some bizarre disease. So I had another cockatiel. I adopted him when he was young, came from a horrible breeding situation. And I adopted him when he was 3. When he was about 7 or so, he developed a heart murmur. The only thing we had, and this again was before echo, so we didn't know what was wrong. And then by the time he was 8 or so, they went to try to get his annual blood, and his neck vein was just all white. There was nothing they could even penetrate to get to the artery. And he gradually deteriorated. He was on a lot of meds. He lasted, we had no idea what was wrong with him other than something with his heart. He died when he was 10, got a necropsy. And it's funny because the gross necropsy didn't really show much of anything. But when they sent the micro away, it turned out he had lymphoma, extensive lymphoma, which had invaded his heart and all blood vessels. That's why they couldn't draw blood. And the lymphoma was everywhere in his body. And it wasn't even seen on necropsy, but his heart, for example, when they cut it open, was completely infiltrated with lymphoma. And that's why he had a heart murmur. We had absolutely no suspicion that he had lymphoma whatsoever, which is another reason why necropsies are so important, because when you have a bird die and you have absolutely no idea why it died, it can be so enlightening. And
yes.
But again, first sign was a heart murmur, and who would think that the heart murmur meant that he had lymphoma?
Yeah, it is definitely a wild one. I mean, the 2 cases of lymphoma I've worked with have been routine blood work where we found it. The bird was perfectly healthy on exam. We did its routine blood work, and that's where we spotted the leukemia. So
yeah, it's just
crazy.
It's crazy. It's crazy. There's so many people that never take their birds to the vet because they're like, oh, they look okay. That's the same thing with humans. You know, that's
Mhm.
hypertension, the silent killer. You could
Yeah.
have your blood pressure can be through the roof, and you may feel perfectly fine if you don't ever see a doctor. You'll
Mhm.
never. The same thing with birds. So,
Absolutely.
do we have any more questions? A lot of you have been very silent. You know, it's funny. I got requests for the Zoom link from several people who said their birds had heart disease and they really wanted to come, and then they never show up. Which is, I never understand why you go through trouble requesting a link and then you don't even show up. But in any case, the talk will be recorded. It will be on our YouTube channel, so you can go back and look at the slides. And this was really excellent. I just have to mention, by the way, I talked earlier about the talk with Alex about the evolution of avian respiration, and he just emailed and we bumped it to June 23rd, so that's the new date. But I'll be sending out something about that, and hopefully everyone will be here. But if there are no more questions, I will stop the recording.